She graced us with her presence the moment we walked into the hospital. She spent numerous hours checking on us, taking care of us, and supporting us. She was the shoulder we cried on and the motivation we relied on. She was everything I want to be. She was a nurse. Ever since I have walked out of that hospital, I have wanted to become a nurse. Therefore, I have done much research on what this career actually entails and how I can actually get there. Today, I would like to share with you about this wonderful career of nursing. I would like to share with you first the educational route to become a nurse. Second, the work settings that nurses can work in. And third, the benefits to becoming a nurse. Let's start on how to become a nurse. The Discover Nursing website offers many different nursing curriculums from different schools, but they all have some similar features as far as their degree plan goes. They all feature basic courses that are heavy in science and psychology, such as their science courses as biology and anatomy and physiology, and in psychology, lifespan and development. They also feature specific courses like geriatric and pediatric nursing. Finally, you have clinical hours in all these degree plans that help you to get hands-on training in a hospital and clinical settings for these nurses. However, there are some differences, such as the locations that people can go to get their education and the different programs that they can take to become a nurse. The first one is that they can go to a community college. At a community college, they often offer a vocational nursing program which enables the student after 1 year to become a licensed vocational nurse. Community colleges also often offer an associate degree in nursing program that is a 2-year degree program, and after completion, this enables the student to become a registered nurse. A different location that nursing students can go to is at a university. Now, at universities, they offer a Bachelor of Science degree in nursing program, which is a 4-year degree plan, and this enables the student to become a registered nurse with their bachelor's degree. Universities also offer a Master's in Science in Nursing degree program, which after 2 additional years after your bachelor's degree program, students can get their master's, go for 2 years, and upon completion, they can become advanced nurses such as nurse practitioners. Universities also offer a doctorate program. Well, some do. There are 24 actually in the United States. And this requires 4 to 6 years after one has completed their bachelor's and master's program. And this also offers the nurse to advance their career. And according to the Educational Portal website, people who want to go for their doctorate, they need to know that the doctorate program is for basically people who are more interested in the research and teaching part of nursing. Now let's look at the different work settings of nursing. A very dear friend of mine, Chelsea Smith, and also a nursing student fellow, once said that the reason she wanted to become a nurse is that it offers a variety of work settings. So if you get burnt out in one area, you can always move to a different area and still stick with your nursing degree. And this is very true. For instance, nurses can work in office settings. One type of nurse is a nursing legal consultant, which actually helps lawyers look at medical records and see if malpractice has been initiated. A different type of nurse that works in an office setting is an informatics nurse. And what they do is they try to establish and create new technology that advances the traditional patient care and different recording that nurses use today. Now, nurses can also work in schools. And the 2 different areas that they can work in schools is they can be a school nurse, which helps students get their medical attention that they need, such as asthma treatment and regular things such as Band-Aids. Or they can also keep up with their students' vaccine records. Nurses in school can also be educators, helping to lead and teach the future nurses of society. Now, your most common nurse is a nurse that works in a hospital or clinical setting. Now, this kind of nurse would be dressed in scrubs just like I am today and may use devices such as a blood pressure monitor. Now, these type of nurses can also be in different areas, especially in a hospital, because in hospitals you can have either cardiology nurses or pediatric nurses, but you can also have like an emergency nurse, which deals with the medical treatment for patients who have life-threatening diseases or trauma, and they seek to get medical attention to them rapidly. Or, like in the clinical setting, a nurse can also work as the nurse in your regular family physician's office. Now, this type of nurse would assess you in your daily tasks and daily living to see what kind of medical attention you need and to give that assessment to the doctor before you actually see them. Now let's talk about the great benefits of becoming a nurse. First off, there are so many job opportunities with nursing. The Discover website has suggested that there are 100,000 vacant positions for nurses right now, and by the year 2020, there's supposed to be 800,000 nursing job opportunities. This means that the outlook for nursing and job opportunities is excellent. The second benefit is that there's good pay and it offers employment benefits. The Bureau of Labor Statistics proposed that the median annual wages of RNs is $62,000 a year as of May in 2008. Many common benefits, employment benefits, that are offered to nurses is medical, dental, and vision insurance. Also with flexibility in schedules, and often places of employment offer child care on site. Now, the third and most important benefit that comes with nursing is that nurses get the chance to improve others' lives, if not save them. It can be anything from, helping a child who has scraped their knee and putting a Band-Aid on it and offering that support, or anything from holding a hand of a dying patient that has, just been in a car accident. Today, I have informed you of the education it takes to become a nurse, the work settings that nurses can work in, and the great benefits that come with becoming a nurse. I hope that you can now appreciate the career of nursing and help to educate others. After all, Rosie Williams once said, "To do what nobody else will do, a way that nobody else can do, in spite of all that we go through, is to be a nurse." Thank you.
Very good.